Well, we're very fortunate today to have with us two folk from HUD, and we know that we have some issues that overlap between the work that we do with veterans and the great work that HUD does. Richard Cho has been with HUD for
2.5 years.
2.5 years, and before that had lots of real-world experience working for the Corporation for Supported Housing and other homelessness-related organizations. And Doug Rice has been with HUD for quite a few years, as I recall.
Oh, no, just 2.5, but yeah.
What were you doing before that, Richard?
I was at the Center on Budget and Policy Priorities doing federal housing policy. Yeah.
Well, he brings a great background. These two are exceptional, and I think they're prepared to talk to some of the issues that we're concerned about, both the AMI issue and the utilization of HUD-VASH and other issues that may come up. So, Richard, do you want to make some opening remarks, and then we can open it up to questions? Oh, briefing. Great.
Excellent. Well, thank you so much for that. And Philip, I've known you probably since 1998 from your days in Massachusetts, so we go back a long way, but I just thank you for your leadership on addressing homelessness for the decades that you've been working on this issue. As Philip mentioned, I'm Richard Cho. I have the honor of serving as Senior Advisor to Secretary Marcia Fudge at the Department of Housing and Urban Development. Actually, we can go to the next slide. We can keep going. I want to just reiterate our commitment to the work of ending homelessness among veterans, which we've been committed to formally since 2010 when the federal government first adopted its first ever strategic plan to prevent and end homelessness, and where there was first set a goal to end veteran homelessness back then. But we've been at it since that time. And our commitment to this is reflected not only in words, but also in the resources that we've deployed. Since 2008, we've awarded over 110,000 HUD VA supportive housing, otherwise known as HUD-VASH vouchers. We've continued to work closely with VA on efforts to address homelessness among veterans, including effective implementation and utilization of HUD-VASH vouchers and working with communities. We've also encouraged homelessness continuums of care to use other homelessness resources to serve veterans who are not eligible for HUD-VASH or other VA homeless programs. And we continue to support communities to really use a variety of other HUD resources beyond our targeted homeless programs, whether that's regular housing choice vouchers or affordable housing programs to serve veterans who are experiencing or at risk of homelessness. We once again reaffirmed our commitment to addressing veteran homelessness as a secretarial priority in 2021, the first year that the Biden administration took office, where Secretary Fudge and Secretary McDonough issued a joint statement reestablishing the work of ending veteran homelessness as a top priority, and also issued joint strategies. And one of those strategies has been how we're going to improve utilization of the HUD-VASH voucher program to be able to serve veterans. We now have, as I mentioned, over 110,000 HUD-VASH vouchers. Just in the last 2.5 years, I believe we awarded an additional over 6,000 HUD-VASH vouchers nationally. We're continuing to work closely with VA to ensure that communities are utilizing every single voucher. And I know that's one of the issues that this board would like us to talk about. One of the specific barriers that has come up, and I think this is relevant to all of you, is the issue about income eligibility for the HUD-VASH program, in particular where veterans have disability benefits that pushes them above the 50% of area median income threshold that is typically the income eligibility for HUD-VASH vouchers. I'm going to turn to Doug Rice, who is our real subject matter expert on the HUD-VASH program and the voucher program, to speak about the issue as well as what actions HUD is taking in partnership with Treasury and other agencies to address that barrier. So turn it over to Doug.
Well, good morning, everyone. So I'm going to talk for just about 10 minutes, and apologies in advance. Some of the things I'm going to mention here, I think you all are already familiar with. In fact, I know Keith Harris was here back in June to give a presentation, and we're covering some of the same ground here today myself. And I should say also, we are relying heavily on some of the data that Keith and his colleagues have provided, and very generously, and that's been very helpful. Okay, next slide, please. Okay, so first, just a little bit of background on income eligibility and how it works in HUD programs. So, as you all know, the housing developments in the West LA campus are financed using a variety of subsidy sources, low-income housing tax credits, project-based vouchers. There may be some local funding sources mixed in there. And each of these, as you know, has different income eligibility requirements. Both HUD-VASH and LIHTC use HUD income limits for determining eligibility. And so HUD calculates these income limits annually, setting limits at 30%, 50%, 80% of area median income in every community around the country. And that's what LIHTC uses, as well as HUD programs. Key point for HUD programs, for including VASH and regular housing vouchers, basically the rules are such that both of these programs are able to assist households with incomes up to 80% of area median income. This is very easy to do in the VASH program. Even for regular vouchers, housing authorities may admit households with incomes up to 80% of AMI for specific populations, so long as they have the policy spelled out in their administrative plan, and the policy is consistent with local priorities as evidenced by the local consolidated plan and so on. So that's the case on the HUD side. On the LIHTC side, as you know, it's rather different. Typically, units that are subsidized by low-income housing tax credits have eligibility set at 50 or 60% of area median income. Now, not too long ago, Treasury issued a new rule that flowed from legislative changes that allows developments to use what they call income averaging. So they can admit households up to 80% of AMI so long as the average income of the LIHTC subsidized units in the development averages out to 50 or 60%. And so the idea there is to allow developers to place some lower income households, 30% of AMI or so, and some higher income households at 80%, so long as the average comes out to 50 or 60%. But that's not something that Treasury has made available to existing developments. It's only something available subsequent to the publication of the rule implementing that change. So, but it's an important change, I think, especially in this context too, and something to keep in mind. I mean, the other thing worth mentioning, and I know you're well aware of this, is that in West LA and in other areas too, there are often local programs, local requirements that are put into place that can also restrict income eligibility. And some of these are local subsidy sources, foundation grants, counties, cities have their own funding sources in some cases. And in many of these really target these scarce resources to developments where eligibility is set at lower levels, say at 30% of area median income. In addition, while I've explained the basics of the low-income housing tax credit eligibility as it exists in federal regulations, it's up to states to allocate low-income housing tax credits to developments. And many states, when these credits are allocated via competitions, in many states, the competitions they set up prioritize developments that are targeted to lower income households for credits. And so this can affect eligibility in developments as well. Next slide, please. Okay, this is just a table that basically puts the same information into tabular form, with one addition. I'll just mention it because I know this has come up in conversations we've had with people in the field. The voucher program generally does have a requirement that 3/4 of the annual new admissions to a housing authority's voucher program have to have extremely low income, so 30% of area median or below. I will add that for VASH, this requirement doesn't apply at all. So for the program that's targeted to homeless veterans, this targeting requirement is not in place. Even for regular vouchers, PHAs may request an exception under special circumstances. Okay, next slide, please. And this table just shows the HUD income limits for the greater Los Angeles metro area in 2023. Just to give you a sense of what we're talking about when we're talking about 30%, 50%, 80% of area median income. And I highlighted the values in the first column there. Single person in HUD income limits are set for each household size, so 1, 2, 3, 4 person households. And I highlighted the one person since I would assume that most of the veterans experiencing homelessness are single person households, though not all of them, obviously. And so you can see at the 50% threshold, the income limit is about $44,000. At the 80% threshold, it's a bit over $70,000. Next slide, please. And here, these are data that Keith and his team generously shared with us that I thought it'd be useful to add. As you can see, this shows breakdowns for a sample of veterans in Los Angeles that were on the by name list. So a little more than 1,700 of these homeless veterans and where they fall on the income scale according to the assessments that VA did. As you can see, about 3/4 of them have incomes no greater than 30% of area median income. And about 87% are no greater than 50% of area median income. But there is a modest share that is above 50%. I will note, though, that just 9 out of the 1,700 were found to have incomes higher than 80% of area median for Los Angeles. So that's about a 0.5 percentage point within the sample here. Okay. Okay, next slide, please. Okay, so that's kind of the basics of the eligibility thresholds. I wanted to talk just a minute about, how incomes are actually determined under HUD rules too. So in general, for HUD programs, household income is gross annual income, but excluding specific sources of income that are specified in the statute, the authorizing statute. And you all may be aware of this, the authorizing statute for the voucher program, let's say, includes 2 specific exclusions of benefits for veterans. There's the deferred VA disability benefits that are received in lump sum or in prospective monthly payments. There are also benefits related to providing aid in attendance under Section 1521 of Title 38. So these are the 2 exclusions that are explicitly mentioned in the statute. And on the view of HUD's Office of General Counsel is that when Congress mentions two explicit exceptions but no others, then Congress is expressing a particular intent here. And it's our view that HUD does not have legal authority to exclude any other sources of disability benefits for veterans. And then the final point is that, as you know, the statute governing the low-income housing tax credit explicitly refers to HUD income determinations for its rules too. Okay. Next slide, please. Okay, let's talk a little bit about, HUD, we should say here, we're keenly aware of the issue that there's some number of veterans experiencing homelessness in LA and probably elsewhere who have incomes certainly that are higher than 50% of AMI, and there's, as the data I just showed indicates, there's some number that with incomes above 80% of AMI as well, and we recognize that this is a problem that needs to be addressed, and HUD is certainly committed to working with its partners at Treasury and VA to ensure that every homeless veteran has access to the supportive housing or other services and assistance that they need to exit homelessness. We're fully committed to that. The question is just what is the right way to get to that end? And so recently, HUD has taken some steps to address this. First of all, while even for the VASH program, okay, housing authorities have authority to admit homeless veterans with incomes up to 80% of AMI, they also have discretion not to. Okay, the current regulations allow housing authorities to set lower income limits if they wish. Now, based on our conversations with the two big housing authorities in Los Angeles, it's our understanding that neither of them does this, but it is a possibility. And so one thing we're doing is making an effort to strongly encourage housing authorities that administer VASH vouchers to admit households with incomes up to 80% of AMI, especially if they've identified veterans in their communities who fall above that level. We've done this in a variety of ways, direct conversations with housing authorities. HUD has initiated, again, brought back a series of what we call HUD VASH boot camps, which bring together VA partners in local communities, housing authorities, other service providers, HUD, to talk through a variety of issues related to the administration of the VASH program. And in those boot camps, we are strongly encouraging housing authorities to admit households up to 80% of AMI. And I'll also mention that HUD has currently in the pipeline some updated VASH operating requirements for the program. So this is a notice that the timing's a little uncertain for reasons I can explain. But we intend in that notice to actually make it mandatory for housing authorities. So when that notice comes out, we anticipate that every housing authority that administers a VASH program will be required to accept veterans with incomes up to 80% of AMI. And then recognizing that this issue, because it's multifaceted, because these developments rely on a variety of funding sources, each with their own requirements, we have been working closely with Treasury and VA to address the issue more broadly and if necessary, to develop a legislative proposal to fix any identified problems. Next slide, please. To that end, we've had conversations with Treasury. Treasury is, and I should just say, full disclosure, we are not official spokespeople for the Department of Treasury in any ways. Yeah. So just to keep that in mind, keep that in mind. Anything I say is certainly based and confirmed by our conversations with them, but I would encourage you to verify with Treasury directly before you go with it. It's become clear in these conversations that Treasury is supportive of excluding all veterans' disability benefits from income for the purpose of determining eligibility for the low-income housing tax credit program, which would be a huge step forward, right? All these developments that currently have income limits at 50 or 60% of AMI, it would largely address that issue in those developments. And they are exploring various avenues for obtaining legislative changes to basically make this change. Federal government, you guys are all well aware of how the federal government works. It takes time to develop proposals like this, work them up the chain, actually get them introduced in a budget proposal or some other avenue, and then there's a whole congressional process. So it is going to take some time, but we are working with them to move that forward. I will mention that in the meantime, I think there are a number of interim steps that are useful to keep in mind. One, as I mentioned earlier, for any future developments that have low-income housing tax credits, and I gather, I'm not completely up to speed on this, I admit, but I gather that there are forthcoming developments in the West LA campus that are still just kind of in their nascent stages, right? Some are already well underway. But for future LIHTC developments, it's important to encourage, if those developments are intended to assist homeless veterans, it will be important in some communities, in the meantime, to encourage them to use the income averaging model for those developments rather than set a hard income eligibility at 50 or 60% of AMI, because that will allow those developments to admit veterans with incomes up to 80% of AMI. So that's one thing. The other thing is that, working in local communities where it's been determined that these income limits are an issue, it's important to the extent that they make use of other funding sources, it's important to work with those funding sources to ensure that their requirements are not inadvertently excluding some vulnerable veterans. Again, these things are not easy, right? These rules are in there for a reason. Typically, those income targeting rules are in there because there's a strong interest in serving people who are seen to be the most vulnerable and at risk. Now, in this case, for complicated reasons, we've got important exceptions to that rule if you just look at the income, right? And my guess is that a lot of these partners who are interested in supporting permanent supportive housing for homeless veterans, they're going to be sympathetic to that argument and might be willing to modify their rules for these developments. And that goes for the state agencies that allocate low-income housing tax credits as well. For these states that are interested in prioritizing a certain share of their tax credits to supportive housing developments that will be assisting veterans with substantial disability benefits, then it would make sense for them to modify their prioritization criteria somewhat to accommodate those. But that's going to take working with the state agencies that set those competitive criteria. And then, of course, as I've already mentioned, encouraging PHAs to make use of their discretion to admit households up to 80% of AMI, which HUD is already doing, but local partners who are aware of that flexibility can help in encouraging them as well. So those are some things that we think are worth pushing in the meantime while we kind of work on a legislative strategy with our partners over at Treasury to move forward more broadly. And that's all I have planned. We'd be happy to answer any questions. I know Eugene sent us a bunch of other questions. We didn't work all of them into the slides here, but we'd be happy to answer other questions that you have, unless Richard wants to step in and add something.
Well, General, happy to take a question if you want to do so.
Sure, Richard.
Okay, thank you very much, Richard and Doug, for your presentation. I think the first flag I saw go up was Jim Zinner, and then Anthony Allman, Keith Harris, and then Dr. Bamberger.
Thank you very much for the presentation, and thanks for the recent flexibility as far as self-certification, as well as extending the length from 60 to 120 days. We were having a real hard time with building 205 and 208, leasing up and getting people in, so that type of flexibility helps not only get veterans into housing, but lessens the burden on our outreach team, so thank you. And just want to point out that our housing authorities in LA County, within a week of that issuance, put together a policy countywide, so we've been using that. I am not the housing authority for LA County, just to be clear. One thing that came up as FMR isn't really relevant, it wasn't part of this conversation, but some of the stuff that we've heard from the VA is that we need to increase the FMR. What we see is that there's not a lot of folks that are even coming close to 120% FMR, so that's why we're not planning to raise that to 160, if you haven't heard that piece. The piece about the flexibility, though, is I wanted to raise, do developers have their own process for lease up? Or developers do have their own process for lease up. Are they being encouraged, or can they be mandated to create similar policies as we have at the county level as far as taking advantage of these self-certification? Because what we've seen in 205 and 208 is the VA has a process, the housing authority has a process, and then the developer has a process. And so we were juggling a lot of things, and with that 60-day mandate, it was killing us. We had to keep going back and getting a new letter of income and stuff like that. And so that would be really helpful if that hasn't been addressed, to address that. And that's it. I'd love to hear an answer on the last question.
Yeah, let me, just on the FMR question, we recently just put out updated FMRs. I believe they reflect a 12% increase across the board, higher in some communities. For the second time, we actually incorporated some private sources of rental income data. We know that some of the federal sources of data on rental costs maybe aren't reflecting some of what we're seeing as the sort of real-time changes in the rental market. So we're starting to use some sources of private data also to inform FMRs, which is why last year's FMR increases saw a significant jump, and also the one that are out right now, I believe still for comment, are also reflecting a significant increase. So that's already out there in terms of new FMRs. With regard to the, you were referring to the recent waivers that we approved for HACLA and LACTA to allow them to issue vouchers to veterans while having additional time to obtain verification of Social Security number, date of birth, disability status, and income sources. I think, so glad to hear that that's already operational. We're eager to see how that actually helps to unstuck some of the housing placement challenges. If there's other programs within those developments that are also not allowing that same flexibility, I think we certainly would be happy to work with LA partners and just providing some technical assistance. It's hard to know what some of the other programs are and what their requirements are for verification before admission, but we'd certainly be happy to provide some technical assistance to help sort that out and see if there's ability to extend those flexibilities for other programs that HUD doesn't administer. So, Doug, you can add.
Yeah, I'll just add that, just to mention, so we did provide these waivers to the two housing authorities in Los Angeles that we hope will significantly streamline the whole process of admitting households and documenting their income and so on. We are exploring, as Richard said, we're really interested to learn more about the experience there as a result of this, but we are exploring ways to the extent that we can within the confines of the statute to extend, flexibilities as much as we can to other communities too. Though, we do believe that some of the more significant changes that will be required would require some statutory change too. On your question about, yeah, I mean, this is an issue we hear a lot about, where a development has tax credits, let's say, and there's a separate income verification process for the tax credits as well as for the project-based voucher. And why can't we just do one income verification process? And, that's another thing that requires statutory change, right? So, there was a recent change, 2016, in the statute governing the housing voucher program and HUD programs that allows agencies to accept, income verifications from other sources within a certain period of time, just to get them in the unit. But the housing authority still has to do its own determination. So we hear more about the flip side, where a household is given a housing voucher, so the housing authority has already determined that they're eligible for the voucher. They find a unit and a tax credit property, and then they have to go through the whole income verification process again. Documents get lost. It extends the time, and that's a thornier issue. That is something that, and we've had numerous conversations with housing authorities in New York about this. There's privacy issues involved, so we've discussed, couldn't the housing authority just share the information, the income information with the other provider? Well, we think a housing authority can do that, but only with tenants' consent, and that's something, there are no HUD rules governing that, but a housing authority could set up, could request consent from a tenant to share documentation with a developer in that case, to at least streamline the process. But that's something that all has to be done on the local level.
Are you aware of Assembly Bill 210 in the state of California, where it allows data sharing?
I'm not sure. Yeah.
Yeah. So there's a state level authority to share homeless data. So that might be something that we could look into. And I would love to connect you with a group of veterans who are actively working to get veterans and their families housed, to get more information about some of the pain points that we're continuing to see in LA County.
Okay.
And I'll take I'm sorry, real quick. I will take the 80% AMI back to our local housing authority. Sounds like a great solution.
Okay, Mr. Allman, next question, and don't forget to identify yourself, questioners.
Thanks, Anthony Allman for the record. I'm not as steeped and educated as some of my colleagues are on the AMI issue. If we can go back to the eligibility slide, this might be a wordsmithing issue, but one of the, the law specifies that two types of veteran benefits are excluded from income. Deferred disability benefits from the VA that are received in a lump sum amount or in prospective monthly amounts. What does that mean? Because when I read that, VA disability compensation is paid in prospective monthly amounts. So to me, that's a little confusing. Can you clarify that?
Yeah, well, that's a good question. And I'm not sure I can provide a satisfactory answer.
My understanding is that in some cases, particularly with veterans who are experiencing homelessness, they may not have been connected and determined whether they're eligible for disability benefits. So they end up having back owed benefits. And so those might be provided in a lump sum payment. That lump sum payment would be excluded. I believe, generally speaking, and Doug, you could speak to the precision, the way that income's defined for the voucher program is income that is expected to be continuous and provided on a regular basis. So any kind of lump sum payment or a one-time payment is generally excluded from income.
So I just thought of this scenario, so I don't expect you to have an answer. But if there is a homeless veteran that gets put into housing, and let's say the County of Los Angeles helps them file a disability claim, and they get a lump sum payment, that will not be counted as income. But the next year when they go to income verify, they are now receiving a VA disability compensation that's going to make them ineligible. for housing?
Yeah, the amount that they're expected to receive on a regular basis, that annual amount would then would be considered as part of their income.
Right, but so then what happens? The veteran is housed, and then they are now disqualified, and then have to find.
So, yeah, go
I
ahead.
can tell you.
Yeah.
So, I mean, just the general issue is, right, so suppose you have a veteran who is admitted to the program, right, because their income is below the threshold, but at some point in the future, for whatever reason, their income increases. Does that make them ineligible? And the way it works in the voucher program is that, so people's incomes are re-verified every year, right? That re-verification is not really an eligibility determination per se. It's for the purposes of determining what rent they pay in the assisted unit.
Oh, okay.
However, if it's determined that the income is high enough that they would receive zero subsidy from the voucher program, then that's an issue. And the way it works, like for project-based vouchers and a project-based voucher development, and this can include supportive housing, the way it should work is if a veteran's income is increased above so they have received no subsidy under the voucher, because the voucher subsidy is based on their income and the rent, right? It fills the gap between their income and the rent. But if the subsidy is shrunk to zero because their incomes have gone up, then there's basically a 6-month grace period. And then they have options. You know, the household and the owner-operator of the development has options. And I want to mention this and I should have mentioned this earlier, apologies for that. Another important strategy here is in doing supportive housing development, doing mixed income developments, right? Where, so some units are subsidized with tax credits, project-based vouchers, but some units are not. And there's sophisticated ways of doing this, you know, so in some places where they know, and I think this would be a great application of this, a developer can make an arrangement with the housing authority to add or remove project-based vouchers from units if they want to put an over-income household in there. So there's nothing to prevent a developer of supportive housing from putting project-based vouchers in, say, 90% of the units under some circumstances. You can't do that generally, but under some circumstances. And then, or 100%, they could start with 100%. And so long as they get nothing but households who are, below 80% of AMI, they're fine. But if they get some who are above, they can remove a project-based voucher from their contract and put somebody into that unit. Now, if the person is already there, what they can do is they can offer them another unit in the development that's not subsidized. They can remove the project-based voucher from the contract for that unit. Or the other option, of course, is the person can move to another development.
Well, this is actually rolling into what I wanted to ask, the big question. I'll make it brief. What I'm concerned about is that we will be so successful in terms of building these units and addressing this AMI issue and getting homeless veterans into these units, and they will be stabilized and they will recover, and some of them will be wanting to perhaps go back to work and integrate into the broader community. And what I'm afraid of, and this is sort of a cautionary tale because I'm rolling off this federal advisory committee, is I think that is not something that we are thinking about. And I think it's something that is absolutely, we need to take that into consideration because all of us here go to work. It's a part of our daily life. It's not saying that they have to, it's not a requirement, but if you are capable of and you want to, the system right now to me doesn't account for that. And so, we've looked at other situations. Dr. Bamberger has brought up, for example, the Social Security Administration PASS program, where a recipient of SSDI can work without losing their disability payment. Now, it's sort of like like a trust account. It goes into, some account. It can only be drawn down for certain funds like education or anything like that. So just broadly speaking, does HUD have a vision for that? I mean, we have to imagine that people will recover and are fully able. And then what?
Yeah, so I think as Doug mentioned, the voucher program, including HUD-VASH, is already designed to allow for that economic mobility. We do want people to work and actually increase their incomes. The income that you have to become initially eligible for a voucher is not the income that you have to stay at for the life of your obtaining that rental assistance. And so there's already built-in flexibility that your incomes can increase, your subsidy level will decrease, not exactly proportionally, but to some degree, up until the point where you become no longer, like as Doug mentioned, your subsidy level becomes zero, in which case you're paying 30% of your income towards rent, and you can afford to do that at the rent level. And that is how the voucher program is already intended to be. Now, yes, there is an issue where if people reach that point where their incomes have increased so much that their subsidy level reaches zero, and then they may feel like they're taking a bigger hit in terms of spending more of their income towards rent, but that is sort of the nature of the program. But I want to just sort of dispel any sort of views that somehow like you have to stay at a certain income level for the voucher program. That's not how it's intended to work.
I think that's helpful clarification. I guess the one thing we need to figure out is, well, what this campus is essentially between Brentwood and Westwood. It's a high rent area. So let's say a veteran does get a job and makes enough to get to the point at which they are now paying zero subsidy. Well, if you're telling a developer that goes to potentially market rent, I mean, that's very high rent in Los Angeles. So I just want to offer that as something to think about, because I do foresee us being successful. And I think that is the next challenge beyond the AMI.
Yeah. That obviously is a bigger challenge in general, which is just that market rate housing is just really expensive and unaffordable in Los Angeles, but frankly all over the country. And I think that's a bigger challenge that HUD is working to solve through other means, which is just to increase the supply of rental housing in general, affordable housing that includes people who aren't necessarily needing a voucher. The other thing I'll say is we also have other programs within the voucher program that housing authorities can use, including things like the Family Self-Sufficiency Program, which I'm not sure how many this has been applied to HUD-VASH recipients, but where people can actually be set up with a savings account, and the amount that they pay towards the housing authority can be put into an account that becomes a savings. Some housing authorities even are able to match that, and that actually ends up helping veterans to gain assets and actually build wealth. There's also
that's super interesting. But I'm sorry, just to clarify, you said that it has not been applied to.
No, I don't. I just don't know to what extent it has, but okay. I imagine it probably has been applied. We'll do a little bit of research on whether FSS has been applied to HUD-VASH.
Thanks.
We've also been piloting with VA some instances where HUD-VASH can be used to support home ownership, and so there is some flexibility to use HUD-VASH to actually help veterans pay for a mortgage rather than a rental assistance. It's a small-scale pilot, but again, there are some tools out there, albeit not at scale, but to be able to help veterans to build wealth. Because we agree with you, we don't necessarily believe that for all homeless veterans that their life must be that they have to live in a HUD-VASH unit. And we've seen many people turn back their HUD-VASH vouchers after increasing their incomes, which is part of success.
Can I just add one thing? I mean,
Okay, let's get Dr. Harris in here.
Thank you, General. Appreciate the presentation and info. And my plan generally is to sort of stay in the background of this dialogue, but I had two quick things about income averaging. Because one of them was something I didn't understand until just last Friday, which is that the average is calculated on the unit income limits and not on the tenant's income. And that surprised me a lot, because we have a very large number of zero income, very, very, very low income veterans. And I figured as soon as you incorporate unit income averaging, fill a bunch of units with zero income, and then you can go up to 80 on the rest. It does not work that way. So I'm just sort of sharing that for everybody. It's the limits themselves on the units that the average is based on. And the other thing, and Doug, I think you noted this, which is it's still only fixes the tax credit piece of this. And so the other sources of financing, the things like VHHP in California or county or city funding, we're still stuck and can't really get around that with income averaging. I love it in concept. It's a little more limited than it initially sounds like it would be, and just wanted to make sure that was clear.
Okay, Dr. Bamberger.
Thanks. You guys great, and we're getting close, which is so wonderful. Our goal here as the advisory board is to find housing for every veteran experiencing homelessness, and particularly the people who are the most disabled as identified by the VA as having 100% disability. And those are the ones we're really concerned about. And you've addressed most of the challenges thus far. We're getting close, but we're not getting all the way. So the first question I have for you, Richard, in particular, is how do you see things that are different about project-based units on campus versus tenant-based units in the hinterlands of Los Angeles? How do you see the services serving people who are 100% disabled as perhaps better or different than might be served outside of the campus?
So, Josh, is your question about what we see as the benefits for project-based units, HUD-VASH, as opposed to tenant-based?
And specifically in the LA situation where, Sally and her team are talking about, have a mobile unit that's parked in front of the buildings, have some nurses that are there. I mean, for the people who are really ill, like when we were at USICH, we talked about the right treatment for the condition, and wondering how you think about project-based units as being the right treatment for some veterans, particularly 100% disabled, versus being out in tenant-based vouchers.
Yeah, I mean, I don't want to make a generalization here, but I do know, I think there's benefits, obviously, to project-based vouchers in particular, but also just project-based, purpose-built, permanent supportive housing in general. I think there's tremendous value in that. As you know, it's very difficult to utilize vouchers in this current rental market where rental costs are very high, and private landlords often can find private renters who are not subsidized to be able to pay rents well above market rate levels. So we know housing authorities are struggling with finding available units in the private market. So there's a cost efficiency to having units that are subsidized at the project level and on the capital side, such as through low-income housing tax credits, to use vouchers. You get more bang for your buck in a project-based setting. But in terms of the benefits to veterans or people who are experiencing homelessness who have greater challenges, there's obviously benefits of having on-site supportive services and wraparound case management that's available on-site. Now, not everybody needs that. I want to be really clear. Not every person experiencing homelessness needs somebody who's on-site. And certainly, we generally promote the idea of integration, that people should live in the community like anybody else. But I know I've personally seen lots of benefits where you have the availability of on-site supportive services, particularly for people who have greater health challenges. There's also the value of community, that being in a tenant-based setting can be isolating if you're not around other people. And particularly for veterans who have experienced homelessness with other veterans, veterans who've been in unsheltered settings where they've ended up living in an encampment and built social bonds. Often it's much easier for them to want to live in a setting where they're able to live with other peers who have similar experiences. So there's lots of benefits to this. But I think we need it all. I think we need both scattered site or tenant-based as well as project-based units. And I'm really glad that there's work happening in Los Angeles to develop purpose-built and project-based permanent supportive housing for veterans. And so that is why we are spending so much of our time on trying to find the solution to ensure that our programs don't become a barrier to access for veterans into those developments.
It's great, thank you. So just setting the table that, we all recognize there are some veterans who really would be better served on site at the West LA campus. And then, so you talked about some opportunities for blending, funding, and so forth to overcome this AMI challenge. But since many, or maybe even all, of the proposed buildings on site also have local funding, some of which are voter approved through HHH, there's no way to raise the AMI cap. So most of the units are 30% AMI, some are 50, and a few are 60% AMI. And that still leaves, maybe 100 veterans who just can't qualify for the units that are on site because of the funding that is built in from jump for these units. So that's why we're getting to this issue of, can veteran disability payments be excluded from income calculations.
Well, let me just quickly say, we're happy to sit down and speak with the funders who provide some of the other state and local resources to see what flexibilities they have on their end to address their income eligibility and how they calculate income. On the issue of why can't, and I think this is probably an elephant in the room question, is why can't HUD just simply exclude VA disability benefits from our income calculations? That is, again, what we believe our Treasury colleagues are contemplating for the LIHTC. Why we can't do that for the HUD voucher program is simple. It's because the way vouchers work is it subsidizes the difference between a person's income and 30% of their income and the rent that's charged. So there's a inverse relationship between how much income a person, recipients of vouchers have, and how many vouchers we have available. In other words, if you start to exclude various sources of income from calculations for the voucher program, all of a sudden housing authorities have to use a lot more of their HUD voucher resources to pay the same amount for fewer number of vouchers. We did some back of the envelope calculations, and we think at a minimum, something like if we just excluded VA disability benefits from income calculations, something like 19,000 to 20,000 HUD vouchers would just be wiped out, right? That could just happen, and that's probably a minimum estimate. And so I don't think anybody here would want to support us actually reducing the number of HUD vouchers that we have nationally. And in some cases with housing authorities, they might be over budget where they actually don't have enough income, enough HUD resources to be able to subsidize HUD recipients currently. So that actually would harm the HUD program by excluding VA disability benefits. We think the 80%, increasing income eligibility 80%, both initially by encouraging and then ultimately by requiring that, actually will solve it for, again, 99.5% of cases that we've seen so far. Happy to look at more data nationally to see to what extent that 80% AMI income limit will actually include the vast majority of HUD recipients. And then I also want to say, if there are a handful of veterans whose VA disability benefits puts them above 80% AMI, I definitely think we need to sit down with VA to look at how can SSVF and other programs fill the gap. Because if their incomes are so high, then perhaps there's other rental assistance sources that don't have those same eligibility thresholds that can also address their needs.
That's great. So just to reiterate, there are two challenges that we're talking about in excluding veteran disability income in the qualification for housing. There's one, the budgetary impact it would have on the local housing authorities. And I think this group would really love to hear a more thorough analysis. Dr. Harris has done a simple analysis on this issue, and the budgetary impact from his numbers isn't particularly great. And in addition, we have 2,700 tenant-based vouchers that, as Philip has said, are sitting in a drawer. They're not being used. So Congress has already allocated funding for those 2,700 units, 2,700 vouchers that the VA has not been able to access that well. So there is some significant, I don't want to use the word surplus, but perhaps unspent funds that could potentially fill the gap in the budgetary hurt that could come if the veteran's disability was excluded. So love to hear your comments on that. And then the other thing that we'll get to in a second is the statutory versus regulatory decisions as to what, does this actually have to go to Congress? But why don't we,
So
answer something about the budget?
I see kind of three categories. So there's three categories of issues from our perspective here, right? One is the legal issue, right? Just that HUD does not have authority to do that right now. Two, I mean, it's a budgetary issue. So as Richard has indicated, in this so far, I mean, these are just preliminary estimates, back of the envelope kind of stuff, but it's based on the data that Keith and his colleagues provided about the distribution of veterans' disability benefits among homeless veterans in Los Angeles, because there are thousands of those veterans in LA who receive these disability benefits, right? So if you exclude all that from income, then, a share of that, roughly 30% of the income excluded, is basically funnels into increased voucher subsidy costs. When you do the math, it amounts to about a 20% increase in subsidy costs for the voucher program for, say, VASH in LA. It's a substantial amount of money and, on the order of millions of dollars. And then, think about what you're doing here, right? So you're excluding income and increasing subsidy costs for hundreds of thousands of veterans in order to open the door to a very small number, ranging in the dozens, right? And so we're talking about increased subsidy costs and millions of dollars to assist a couple dozen veterans who are not eligible. The per additional cost of assisting those households is really big, okay? Plus, as Richard says, yeah, so there's these, couple thousand, I don't have the number here, of unused VASH vouchers, as you mentioned, the agencies have the budget authority for those. But if you exclude disability benefits from income, that budget authority goes to cover that increased subsidy cost. They no longer have budget authority to issue and lease the remaining vouchers they have, or at least for a share of them, not all of them, but like some share, like a third of them or something. So that's that trade-off. The other issue that honestly we worry about at HUD has to do with fair housing and discrimination. We worry at HUD that it puts us in the position of treating different categories of people with disabilities differently, just based on the source of their disability benefits. And so you could even imagine, if this were done, right, you've got two veterans in a supportive housing development, equally disabled, but because one of them receives benefits from VA and the other just relies on SSI, the one that relies on SSI is paying rent, right? And the one that receives disability benefits, because those are excluded from VA, they're paying no rent at all. And that creates substantial questions of equity in our view. I'll add too that, honestly, I don't think anyone disputes that, given the level of benefits that we're talking about here, these households can afford to contribute some money to rent, right? That's not really the issue here, right? The issue is they need access to the supportive services that come with supportive housing, right? That's what they need from these developments. And so, excluding the benefits, dropping the rent to zero in order to ensure that they have access to the supportive services in the housing that they need to move off the street, it's a suboptimal solution by a long stretch.
Yeah, so we're getting there, and I really appreciate it, and it really feels like you guys are digging into this in the way that we had hoped. And we're running out of time, and I know that there are a couple more questions that want to come, but the issue of statutory versus regulatory decisions, I just want to highlight, the recent HOTMA changes created some greater control over deciding income for veterans. And these regulations are going to go in effect on January 1st of 2024. And these specifically give the HUD secretary the opportunity by notice, not even by regulation, but by fiat, to change the definition of income for veterans. So wondering if this new change, which is taking place just in a couple months, could perhaps give HUD the opportunity to make these income changes without having to go to Congress for regulatory for statutory changes.
Thank you, Josh. I want to just point out, yes, HOTMA gives flexibilities, but within the bounds of the law. And as many HUD attorneys and lawyers across our program offices, as well as at our Office of General Counsel, have looked at this issue and understand that what the law dictates for HUD VASH and vouchers is that you cannot exclude VA disability benefits, notwithstanding the flexibilities we have under HOTMA to look at this differently. So we still have to abide by the law, and the law is pretty clear that there are not statutory ability to exclude VA disability benefits. Not to mention what I think Doug and I mentioned, that this would actually harm the HUD VASH program by just reducing the number of vouchers. Let me also just say this. Our voucher program is on the discretionary side of the budget, all right? If more people qualify, it's not that the HUD's budget goes up for tenant-based rental assistance. We deal with annual appropriations. And that is why actually in the president's FY24 budget, we requested Congress to create a new mandatory voucher program for all extremely low-income veterans. That would be universal on the mandatory side of the budget. Now, we all understand the realities here in Washington, and that's probably not something that is being contemplated. But again, that is our statement as an administration that we believe that all extremely low-income veterans should have the ability to have a voucher which would actually prevent and potentially eradicate homelessness among veterans. But again, under a program that is on the discretionary side, that's subject to annual appropriations, where clearly the number of vouchers in general that are available do not meet the need of the number of people who qualify. We are dealing with a fixed budget, and therefore excluding income actually ends up just shrinking the number of vouchers. It actually would, I think it would harm our efforts to end veteran homelessness.
Right, and that's great. Now, I'm going to stop. This is my last one. Why can't you, again, either through statutory or perhaps regulatory changes, state that the total income that someone makes, including disability payments, is used for rent calculations, and excluding disability income for the purpose of qualifying for housing? So change the story so that you won't have the budgetary hurt because you use a different number for rental calculations versus calculations that are necessary to qualify for the units that are restricted by the LIHTC.
So
limits.
that's not something we can do under current law, right? It would require a statutory change. However, I mean, I'll point out that what you're talking about is so basically allowing excluding income to be able to say, well, these guys are eligible for vouchers. But then when it comes to calculating the rent, you take the benefits into account. And so then what happens, of course, in most of these cases where we're talking about people with incomes above 80% of AMI, the subsidy shrinks to zero, right? And so, or very close to zero. I mean, that's the way it works in most communities around the country. As you approach 80% of area median income, the amount of subsidy in the voucher program, because of the way it's calculated, is going to shrink to zero. And so I think that sort of raises the question, why are we giving this person a voucher if they don't need a voucher subsidy to pay the rent, right? And I think the answer is the one I gave before, because what they really need is the supportive services that go with the housing. And so we ought to be looking at ways to ensure that people like this can access the supportive services in housing, but without taking up a voucher that they don't really need to cover the rent. You know, that's the way I think about it. Yeah.
Yeah, let me get Rob Beglin here before we run out of time.
Can you hear me? Yes. Thank you, General, and thank you, gentlemen. Good presentation this morning for a layperson like me who struggled to read both the statute and the regs around income. We all do. It was great. You laid it out, I think, very clearly. But I've got a bunch of tough questions for you, and I'm going to preface them by telling you that the explanations we've heard this morning are very much national explanations, but California, when it comes to homelessness, is a stubborn outlier in the nation, and Los Angeles, when it comes to veteran homelessness, is a stubborn outlier in the nation. The existing policy solutions are not working in Los Angeles, and they're not working generally in California. So as an advisory committee, we're left with trying to make recommendations to the secretary. And so we've been watching at a distance kind of this interagency debate between HUD, Treasury, and VA on what's the right way to go about this. So I guess the first question I have for you is on the legal, to kind of take your framework, Richard, legal, budgetary, and equitable. I think that's a good framework. We read the statute that takes effect as January 2024 as plainly conferring on the Secretary of HUD congressional authority to proceed by means of either rulemaking or notice to change the definition of income. I mean, I trust your lawyers have basically told you that when Congress says you can proceed by virtue of notice, that's even greater flexibility than proceeding by notions of rulemaking, right?
You're referring to HOTMA then?
Correct.
I will say that our legal understanding, and I'm not a HUD Office of General Counsel staff member, but what I would say is one of the kind of foundational aspects of the voucher program is income eligibility. It is sort of like what the voucher program is all about is ensuring that it's about income eligibility. And so within the bounds of what we have authority to change, one of the things we cannot change is just how income is actually defined, and you cannot have one definition of income for purpose of eligibility versus how much subsidy. That's sort of like built into the nature of our program. We've had many conversations with our Office of General Counsel, and believe me, as much as we are searching for a solution to this issue, we've continually pushed to ask if there is legal authority, and our understanding is that there is not legal authority.
So I totally get the premise that if you make a definitional change to income, it flows through to adjusted income. Totally get that premise. But I want to emphasize, I'll just read it to you. And I'm a lawyer, so I want you to go back and challenge your lawyers. But I think Congress spoke very clearly when they said excluded amounts, such term does not include exclusions from income as established by the Secretary by regulation or notice. So I think it's clear, and I would really encourage you to challenge your lawyers on their analysis, that the Secretary can proceed by means of notice after January 1st, 2024, to change the definition of income. I get that it flows through to adjusted income and the rental subsidy, but that now becomes a budgetary discussion, not a legal discussion. And so, I think one of the things we're going to struggle with as a committee is, if there's a congressional solution, is it a congressional solution around definitions, or is it a congressional solution around budget? Let me shift to the budgetary question. Doug, you said that you guys, or maybe it was you, Richard, you guys have done a back of the envelope calculation and seen what would happen if HUD excluded disability benefits from Los Angeles, and I think you said several $1 million. That number does not knock me out of the back of my chair, because I don't look at this as a problem of potentially dozens of people. I instead look at it as, we've got something like 500 veterans in the LA catchment who are at 70% disability or greater. So I look at that population as the population that's at risk of being ineligible when we want them to be eligible. So when I hear a number of several $1 million, I'm like, I've heard of the federal government spending that much money to solve problems like this. It doesn't cause me to kind of recoil. But let me ask you some practical questions. When you look at the two LA housing authorities, is there a separate HUD-VASH budget that's a separate from Housing Choice? In other words, are those separate allotments annually?
Yes.
Okay. All right. And could you give us a sense as to what the exact impact was? I know it's a back of the envelope calculation.
Just to clarify that. So the initial budget authority for new VASH vouchers is allocated separately to housing authorities, and they keep that money separate. Now, when it comes to renewing VASH vouchers, though, they go into the regular renewal formula that all the vouchers, get renewed through. But housing authorities typically ensure that they have enough money on hand to cover their VASH vouchers. So it is handled separately to some extent.
Okay.
It basically is one account, but they have to track the HUD-VASH budget authority separately, and we have to also report on HUD-VASH budget authority separately in terms of how many people are in HUD-VASH. And anyway, so.
Okay, and then the final point, and I thought it was a great one for you to raise, Doug, is this equitable one. And you're going to hear this from us in a way that you won't from any other group. I think there is a principled reason for treating veterans' disability benefits different than other disability pay. You've got to remember the definition of VA disability is a mental or physical illness incurred or aggravated during military service. I think there are equitable grounds for treating that population differently than others. You're going to hear it's an advocacy question, but I think reasonable minds could differ and say, yeah, that's a reasonable basis for treating these things differently.
We're happy to further look at this, and certainly we'll bring back to our who will be very unhappy lawyers about looking at this issue yet again with us. But just to come back to the budgetary impacts here, Doug mentioned it's maybe millions of dollars just for Los Angeles. But we have to, I think, keep in mind, if you exclude VA disability benefits from income calculations, that includes all the veterans who are currently in HUD-VASH currently. And we can't do that separately for Los Angeles than we can for the rest of the country. And so the national impact of this could be fairly significant, where all of a sudden we don't have the full data on how much income we're talking about for HUD-VASH recipients currently and then future projected HUD-VASH. But we could be in a situation where the net number of HUD-VASH vouchers actually decreases below what it is today by potentially 20% or more, right? And so 110,000 HUD-VASH vouchers right now, we could be down to 80,000 HUD-VASH vouchers. I don't know how that would help us set back. That's a much bigger gap in terms of what I believe there's appetite in Congress to fill. And again, that would only make the program whole, not actually add more to HUD-VASH.
Yeah, I mean, I think I really appreciate this is very informative. Ask the lawyers if you could proceed by means of notice to have the secretary treat LA differently or treat California differently. I think that's a classic example of if the White House is pushing for the state of California and Los Angeles to be the subject of homelessness initiatives, the type of thing that if you do it by notice and you limit it to those markets, it's a good example of proceeding by notice and not a reg of general applicability. Thank you.
Mr. Mangano.
Just to support Rob's point about the extraordinary nature of the disability that veterans have, in our conversation with Deputy Secretary Todman last week, that was exactly what she asked us to do, was to define the acuteness of that disability and distinguish it from other disabilities so that, in fact, there would be a clear case for HUD to take action for those 70 to 100%. Obviously, we understand the difficulties. OMB would push back where you'd have to do it for everybody, therefore we can't do it for anybody. It was similar to what happened with the chronic homelessness initiative. We had to define very specifically what chronic homelessness was, well, we knew that OMB would never go for it. So we are going to work on that paper that Deputy Secretary Todman asked for, to provide HUD with a document or a thinking paper about what holds those folk in a place where they should actually receive this benefit in terms of disincluding their disability benefits. But I actually wanted to ask about this. So HUD is supporting this, right? The Treasury is going to exclude the possibility that Treasury will exclude VA disability benefits. So wouldn't that be, Doug, the very issue that you're talking about, in that would exclude those benefits, therefore there would be less income to HUD, therefore there would be potentially fewer subsidies. So can you help me with that and distinguish why that isn't the case?
I mean, Doug, I'll let you elaborate if this, but Philip, so the tax credit program is different in that the amount of subsidy is not relative to people's income, right? They have an income eligibility definition for people who can get in, but the amount of the tax credit doesn't go up or down based on the income level of the veteran. So excluding VA disability benefits for LIHTC purposes doesn't have any budgetary impact on the tax credit program because the subsidy is built into the units and that tax credit is there regardless of whether they're at 50% of AMI or 80%, and if disability benefits go up or down, if that answers.
So there would be no impact?
There would not be a budgetary impact by excluding VA disability benefits for purposes of LIHTC.
In a LIHTC?
Correct.
What about in other forms where, for example, in some of the home key efforts, it's state money being utilized to expedite matters so that LIHTC doesn't require a couple more years to get something done, that the dentists don't have to worry about that, the dentists who invest in that.
I mean, I think this is a unique, the exclusion of disability benefits has a unique impact on the voucher program because of the way vouchers, the amount of the subsidy goes up or down based on whether people's income goes up or down. LIHTC other capital sources such as our home investment partnerships program or anything else that brings the sort of this kind of rent schedule down for those units, that doesn't change based on what's included or not for income. So it is a different calculus. I think we should probably pointed that out proactively. But
So in some cases, the exclusion of that resource would have an impact on the number of vouchers, and in other cases, it would not.
it would not on the LIHTC program.
Not in the LIHTC. And the presumption is that most all of these are LIHTC, is that right?
I mean, LIHTC is probably the largest engine of affordable
No, it
housing
is
development. So
one of the
we're
largest.
assuming that most of these developments have.
But not exclusively. I mean, there are efforts going on where LIHTC is not being utilized. It's the state money that's being utilized as a capital investment up top.
Right, and then it's just a question of what is calculated for purposes of income eligibility for any of those state or other capital sources. But again, those capital sources the subsidy level of those capital sources doesn't change based on what's calculated as income. So again, this is unique to vouchers where you're paying a gap between income and rent levels. The other thing I'll just say is, if for those 0.5% of estimated homeless veterans whose VA disability benefits pushes them above 80% in AMI, if they're in a tax credit development, the base rents are already below market, right? And so there may be ability for them to afford that unit with their VA disability benefits in a tax credit property and potentially still avail themselves of the supportive services that are available on site. And that's something we can certainly discuss further with VA as to how HUD-VASH case management can work in a site-based, project-based environment.
So two more quick questions, if I might, General. What do you think is the most significant impediment to getting the AMI issue resolved and getting those veterans into housing? Because what we hear is a bit of a conundrum. We talked to your deputy secretary, and she feels that is a bit of a conundrum. She can't quite figure out why it's not done. We talked to the VA. There's movement, but it's not getting done. We haven't talked to Treasury, frankly, but I presume they're thinking that there's some conundrum aspect of this, or it would have been done a long time ago if it was a simple, rational matter. So I know you've been involved in this, Richard and Doug, what's your sense of what the major impediment is in getting this done?
I think it's conundrum because of the many layers of funding that all have different income eligibility calculations and definitions. For the HUD side, it's not a conundrum. I think we have already issued communications from our principal deputy assistant secretary to housing authorities nationally that they should use the flexibility right now to increase HUD-VASH eligibility to 80% AMI. As Doug noted, we very much intend to actually make that a requirement at the point at which we can actually issue that revised notice. So we're already taking those steps. That's moving forward. To address the LIHTC barrier, that's something that Treasury would need to take legislative action on. Our understanding is that they are working to do so. But again, that will require Congress to make what I believe is a very small statutory tweak to LIHTC statutes.
So is the primary impediment now, from your perspective, since we had the VA secretary here earlier, eager to resolve this, you're saying that from your perspective, eager to resolve it. So is the major impediment Treasury making this decision? Is that the impediment that we need to target our advocacy to?
It is one of the impediments. And again, I encourage you to talk to Treasury. I don't want to speak, or Doug and I cannot speak for Treasury. But our understanding is they are supported as an agency and in their leadership level of pursuing the legislative tweak that would exclude VA disability benefits for LIHTC across the board, and that would be something that, again, Congress would need to act on. And so I encourage you to talk to Treasury about what legislative change they're seeking, and then determine whether there's support in Congress for that.
So if this would occur, your bullet point 1, that would pretty much resolve, that would get the 3 major agencies involved and get this resolved and this would no longer be a significant issue.
I think,
Is that right?
well, to the extent that there's other state and local sources that also have different income eligibility rules, that is the next step for us to speak with partners in.
But most all of them base what their eligibility rules are on HUD definitions. I mean, isn't that right? They do 30, 60, 80, up to 120. I mean, all of those determinations, mostly from foundations, from LIHTC, they're using HUD's percentages, HUD's income eligibilities.
Yeah, I mean, we probably need to look at what those sources are, what their rules are. And there could be any number of changes that there could be made at the state and local level, either on whether they exclude disability benefits for purposes of income calculations for their programs, or whether they can actually say if a veteran has already been qualified for HUD-VASH or other vouchers, they are considered automatically income eligible for their project. There's a couple different pathways. We just need to have the conversations with state and local agencies to see what they can
Well,
do.
we're certainly hoping that this gets resolved. It seems to be taking a lot of the air in the room of other larger issues. Finally, we would be remiss not to ask about HUD utilization, HUD-VASH utilization. You know, one of the things that we've noted is there are 25 unutilized, unutilized, like 2,500 unutilized, about 5,500 in our state. Here in California, about 22,000 across the nation. So just wondering what further actions you've been taking on that front, because I know we brought that issue to HUD several years ago.
Yeah, so this is a top agency priority, is increasing voucher utilization, particularly for the HUD-VASH program. It is something our deputy secretary has charged and is closely monitoring. We're taking a number of steps to do so. Doug mentioned the HUD-VASH boot camps that we've reinvigorated. That was something we did in a prior administration. We've revived that. We've held a few already. We have one in the Los Angeles region scheduled for, I believe, in December, if not November. And that is where we bring together housing authorities and their VA partners. One thing we learned through our initial sets of these boot camps that we've held in the Midwest and in the Mid-Atlantic area so far is that has been a lot of staff turnover both at VA medical centers and at public housing agencies. And the level of collaboration and understanding about the flexibilities they have for HUD-VASH, a lot of that memory has been lost, and so that institutional memory. So we found these boot camps to be incredibly helpful in just unsticking a lot of these bottlenecks and challenges to increasing HUD-VASH utilization. But Philip, I'll assure you, it is a top priority that we're working on. We also know VA is working very hard to fill staff vacancies, which is also challenging. We know, and that's true for all human services sectors. It's just really difficult to fill staff vacancies. But that is another aspect of this work as well, is to ensure that homeless program staff at the local level are being hired and retained. VA is also working on, and I'm sure VA can speak to this, collaborative case management, so that the intake for HUD-VASH isn't tied to the number of HUD-VASH case managers in a direct way, but where a team-based approach to case management would enable some more flexibility so you can intake more veterans even as you're trying to fill staff vacancies.
So has there been some impact on those numbers of the unutilized, the 2,500 in Los Angeles, the 5,500 in California, 22,000 across the nation? Are there tangible results to everything that you just mentioned?
Not yet. We're hoping that these boot camps and some of the other work we're doing is going to increasing FMR. So the sort of like multi-pronged approach we're taking to increasing HUD-VASH utilization is going to start seeing results in the coming months. But we've seen the utilization rate stubbornly stick to about 75% of HUD-VASH according to HUD's calculation. So it's something we're concerned about. Working on ensuring that there's sort of two aspects of this. We need more veterans to be referred to HUD-VASH vouchers and vouchers to be issued. Secondly, we need to help veterans to lease, use those vouchers to lease in the private market. And we know the rental market is pretty brutal right now. It's very competitive, and rental costs are still remaining high. A lot of competition for those units. So I think HUD, I speak for VA and HUD to say we're doing all we can to ensure that we're improving the issuance side of this, the sort of front end of referrals and issuances. With lease-ups, we could use a lot of help from community partners to engage landlords, make sure that we're marketing the HUD-VASH program for the excellent program that it is, and ensuring that landlords are being brought into the program, because we could use a lot more help in finding vacant units and landlords.
Is part of your quote-unquote boot camp several administrations ago. We call them policy academies, and that seemed to have a higher level of commitment of state officials and local officials, calling policy academy as opposed to a boot camp. But I'm wondering, is part of that being more sophisticated with regard to housing search? So for example, one of the things we've done here in Los Angeles is bring to the table people who know how to do housing search in a very professional manner, essentially creating real estate agents for homeless people. So is that part of what you're doing in your quote-unquote boot camp?
It is, and what we go through in the boot camp is a review of all of the operating requirements and all the existing flexibilities. And I tell you, I actually participated in the Chicago HUD-VASH boot camp we held in Region 5, and I could tell you how many light bulbs went off in the room when we talked about the flexibilities that exist in HUD-VASH program. Staff just didn't know about these flexibilities, so we're encouraging that. But every team of VA medical center staff and public housing agency staff that participate in this must come up with an action plan that they have to implement within the first 6 months. And that action plan can include things like we're going to increase our income limits to 80%. We're going to actually take advantage of the flexibility to go to 120% of FMR. It could be that VA is going to make process improvements so that they can actually refer more veterans to PHAs, even though, even if their staffing is low. There have been a number of things that have surfaced through those boot camps that are coming in these action plans.
Just to be clear, in the boot camps, beyond having VA staff and HUD staff and the local entities, there is technical assistance, expertise on how to do a better job creating landlord-targeted engagement.
Absolutely. We reinforce, and we've done a lot at HUD over the last several months in terms of providing more flexibilities around the voucher program. For example, actually, and Doug can speak to this, but we issued a notice clarifying the broad uses of administrative fees that we provide to public housing agencies. We clarified that you can use those fees for housing navigation, landlord search, paying security deposits, some move-in expenses, including landlord incentive fees that we're actually allowing housing authorities to use those admin fees to pay signing bonuses and things for landlords or risk mitigation funds. So we're putting out all stops in terms of just what flexibilities they have. And now it's about getting the word out. I mean, I understand not everybody reads HUD notices as closely as I do. And so I think that a lot of this is just getting that word out to the people on the front lines who actually administer and operate the HUD-VASH program, both on the HUD, the PHA and the VA Medical Center side.
Yeah. Yeah, and I would just say finally, so what we're looking for are results. And so far, there aren't any, according to you. And this is an issue that we've raised, I think, for most of the 6 years that we've been together. So we're very eager to hear that the numbers of utilized HUD-VASH are up. The utilization rate is up.
Yeah, I mean, I'll say we've seen more leasing of HUD-VASH. We've seen more issuance of HUD-VASH. We're also seeing some challenges of retention as well. And so the net number of vouchers under utilization has remained stable even though and again, the other thing about this is we're adding more vouchers even so the denominator is increasing. So, it's not that we're not seeing progress, but again, I think some of the work we just started beginning at the end of August and that we'll be continuing over the next several months with these boot camps, with some of the flexibilities that we are continuing to message out to PHAs. We hope to see those results actually translate into outcomes in the next few months, and happy to report back on what we're seeing with that, and also to receive other suggestions and ideas from this committee.
Thanks very much. We're out of time. We appreciate your time and the briefings. 30 seconds for Dr. Harris. You're well into your margin here.
Okay. Richard, I know you talked about going back to the OGC attorneys yet again on something, and I've actually had some of my own conversations with your attorneys about this issue. I just want to make sure it's really clear what Rob and Josh were saying, which is that as far as I know, all of their analysis to date has been based on the existing definition of income, statutory definition of income. There is a new definition taking effect January 1st that provides that clause about other exclusions by the Secretary by either regulation or notice. So I think what you're doing is going back and asking for a new analysis. You're not asking them to retread any ground. This is completely different in the sense that they have relied up till now on the fact that the current statutory definition only referenced deferred VA disability payments. Now there is an additional clause saying, or others as Secretary
Yeah,
determines.
so what's going into effect in January are the provisions of a new regulation that HUD released earlier this year. And there were extensive discussions about that HOTMA authority in the development of that regulation. And so that's been hashed through very thoroughly by HUD.
So Doug, now there's a new statutory definition that has been in existence for a long time that has not taken effect. I can send it to you. It's not just the regs.
But that's what we're talking about is this is the implementation of the HOTMA change, right? Which is.
Oh, I understand that.
what
And
you're
I'm
talking
happy to, I know we're out of time. I'm happy to pick it up with the outside, that there is both the regs taking effect, but there is a new statutory definition that has added
The reg
leeway for the
is, the new
Secretary.
reg is implementing the new statutory changes is what it's doing. So there's a very close connection between those.
Understood.
Just really
Okay,
quick,
thanks.
I'm sorry, just,
Thanks
it
very much.
doesn't require a response.
Who's that? I'm sorry.
Jim Zenner for the record. Can I have just quick 30 seconds?
30
I
seconds.
want to illustrate why this is so important. So
Yeah,
if
we
you look,
understand it's important, Jim, so go ahead.
the Peer
Take
Access
your time.
Network in LA County is working with veterans to get them off the streets. What I'm hearing from them as they're getting their brothers and sisters off the street is they're hesitant to bring them to the county veteran service office to get benefits because they don't want them to be homeless. And I just wanted to ground us in the importance of this conversation today. That's it. Thank you.
Okay, we're going to have another discussion on this as we look at our recommendation. So points like that are re-emphasize that when we get to that. Okay, we're well into our lunch hour, and as a reminder, you've got to be back at 12:45. Our next 4 presentations are virtual, and so we need to be in place.